Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
How teletherapy changes access to mental health care for busy adults. Most adults already know they should probably make that appointment. The problem is everything else on the list: work deadlines, school pickups, grocery runs, and meetings that run long. Mental health care ends up getting rescheduled until it doesn't get scheduled at all. Teletherapy, also called online therapy or online counseling, changes that equation by removing many of the practical reasons people put care off. This episode looks at how virtual mental health services make ongoing therapy and psychiatric treatment more accessible for adults who are trying to maintain consistent care without upending their routines. The practical barriers that keep busy adults from in-person care. Getting to an in-person appointment is a whole project. There's the commute, the parking, the time carved out of the workday, the childcare you need to arrange, and the waiting room at the end of it. For a motivated person on a calm week, it's manageable. For someone already stretched thin, it often isn't. According to the 2024 National Survey on Drug Use and Health from SAMHSA, 23.4% of U.S. adults, that's about 61.5 million people, had some form of mental illness in the past year. Of those, roughly 52% received treatment. That means nearly half didn't. That gap isn't only about stigma or cost. For a lot of people, logistics are the wall. Even patients who want to be in care will sometimes skip an appointment because the day is already too full, and showing up feels like one more impossible task. Teletherapy reduces or eliminates those friction points. There's no commute, no parking, and no need to take an afternoon off or find someone to watch the kids. That shift doesn't sound major until you're the person who has been meaning to call for 3 months. How teletherapy makes care easier to fit into daily life. Online therapy works because it fits into the margins of life rather than requiring you to reorganize around it. Sessions can happen from a home office, a parked car, or a quiet corner of an otherwise busy day. Evening and lunch hour appointments become realistic in a way they usually aren't when travel time is part of the equation. The data supports this. According to Kim et al. Study, 65.6% of telehealth users said convenience was a primary reason they used it. The study surveyed 6,252 U.S. adults and found that 80.5% had no technical problems, and 75% said care quality was comparable to in-person visits. These numbers matter because they push back on the assumption that virtual care is a compromise. For most people, it works. What makes online counseling especially practical is that it removes the appointment burden, the total time cost of attending care. When a 50-minute therapy session doesn't require 2 hours of your day, people are more likely to keep it. Teletherapy supports more consistent treatment. Mental health care tends to work better when it happens regularly. That's not a complicated idea, but it's one that in-person care can quietly undermine. A busy week, a mild cold, or a car that needs repairs can become a reason to cancel. Teletherapy lowers that threshold. When showing up means opening a laptop instead of getting in the car, minor disruptions are less likely to become missed appointments. A large Medicare study by McBain et al. Looked at nearly 9.5 million beneficiaries from 2019 through 2023. Before the pandemic, telehealth accounted for just 2.1% of outpatient mental health claims. During the pandemic, that rose to 54.4%. In the years after, it settled at 42.9%. Total mental health claims stayed relatively stable throughout. That's worth sitting with. Even after in-person care became available again, close to half of outpatient mental health visits were still happening virtually. patients didn't abandon the format when they had the option to. For conditions like anxiety and depression specifically, that consistency matters. A 2024 study by Spalding et al. Found that among adults with depression or anxiety, 56.77% had used telehealth in the past year, compared with 31.75% among those without those conditions. That gap suggests these patients are actively seeking out the format. It also makes sense. When low energy or dread is part of what someone is managing, removing an extra logistical layer can make showing up feel possible. How teletherapy handles psychiatric treatment and medication management. Psychiatric treatment often involves more than a weekly session. Medication follow-ups, side effect check-ins, dosage adjustments, and prescription reviews are a regular part of care for many patients. In person, those visits can require taking half a day off work for an appointment that might last 15 minutes. Virtually, that same check-in can happen during a lunch break. A 2024 study by Cantor et al. Surveyed nearly 1,400 outpatient mental health facilities and found that among those offering telehealth, 76.7% provided medication management virtually, and 96.9% offered counseling online. That combination matters because medication and therapy usually work best together. Having both available through virtual care means patients don't have to choose between one or the other based on what they can logistically manage. For busy adults managing conditions that require ongoing psychiatric treatment for depression, anxiety, ADHD, and PTSD, teletherapy can make it realistic to stay engaged with both sides of a care plan without constantly rearranging their week. Make consistent care work for your life. The appeal of teletherapy for busy adults is straightforward. It removes the logistical reasons people delay or drop out of care. No commute, no waiting room, no rearranging childcare. For the millions of adults who need mental health support but struggle to access it consistently, that shift is meaningful. Virtual care isn't a substitute for real treatment. It is real treatment, and it helps people stay in it. At Zeam, we offer teletherapy, online counseling, and psychiatric treatment designed to fit around your schedule. Whether you need recurring therapy sessions, medication management, or both, our team can work with you virtually so consistent care doesn't require a perfect week to happen. If your schedule has been the reason you haven't started or stayed in care, contact us today to schedule an appointment and build a care plan that works for your life. Thank you for listening to this episode of More Than Medicine by Zeam Health. Next week, we will be discussing women's mental health issues that are often overlooked. Until then, have a great week.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.